The evaluation plan for this communication issue can be answered with the next 3 questions. The first question is, can a goals of care discussion occur at day 3 of a complex hospitalization? 2, who will initiate and put together the meeting and gather everyone that is involved in the patient's care? 3, should this person be the same person that will follow up with the family if they have not decided or make any decisions within 5 days from the initial goals of care discussion? Quality indicators that are appropriate to this plan is the inpatient quality indicator. This indicator reflects on the quality of care that occurs inside of the hospital that includes mortality rates. If a patient with a complex medical history gets admitted into the hospital for a diagnosis that could not have a high chance of improvement with surgery or complex care, such as drips, ECMO type situations, this should be considered a misuse of utilization of procedures. Communication and discussions of goals of care should be initiated as soon as possible. This would provide the family enough time to discuss and make necessary arrangements, rather than preparing the patient for an unnecessary surgery that does not provide good outcomes. I would be able to measure this indicator by the diagnosis, the surgical procedure that is performed, and the mortality rates that occurs. If it is confirmed that the patient would not benefit from a certain procedure and should sign on with hospice, this would show as a quality indicator to discharge the patient with hospice. Another indicator that is appropriate for this communication care management plan is that the patients are provided information for recovery at home. This ties in with the communication related to post-hospitalization to prevent readmissions. A complex patient with multiple follow-ups or multiple coordination that is needed, a case manager that is assigned would be helpful to communicate with the patients and their family to ensure that all needed follow-ups are set up once they are home. This indicator could be measured by the reduced rates of readmissions, and a survey could also be sent out that would measure that the patient had received the appropriate follow-up discharge plans and instructions. How we measure these outcomes could also be in the data world and analytics. The programs could be evaluated quarterly to determine effectiveness, and the data could be discussed quarterly to see where changes can be made if more time is needed, to see that there could be outcomes that are positive for this issue.